Hello, my name is Carrie Bond. I am a medical laboratory technician certified. I am affiliated with Winston-Salem State University. Also, my contact information is over here on the end of the board. If you want to know more or be able to get in contact with me, feel free. And also, if you have any comments or questions or concerns, you can comment below and I'll be sure to respond to it. So I just want to thank you all for taking the time to click on the video to be able to watch me present my presentation. I really appreciate it. I also want to shout out my mentor, Candace Freeman, who has been very, very supportive. She has always been there for questions and comments, and just really, I was really able to feed off of her, and I just thank her so much and just want to give her that shout out. So where we want to start at is the title. So the title of this presentation is The Correlation of Cirrhosis of the Liver and Brain Damage Due to Ammonium Elevation. So in this study, this is a non-experimental design, which means we don't want to use a control group. We don't want to use people that's already healthy. We want to use people who have cirrhosis of the liver, and we want to use people who already have brain damage, because what we want to do is we want to test their ammonium levels. We want to see if the ammonium levels in the cirrhosis of the liver and the ammonium levels in brain damage, if they correlate any way. We want to see if maybe they increase together. If someone who has cirrhosis of the liver has a high ammonium level, do it means that they already have brain damage? If it's somebody who already have brain damage, you know, vice versa. So we just want to see if there's a correlation. And in seeing if they have a correlation, we will be able to maybe prevent people who have cirrhosis of the liver, prevent them from having brain damage. And the same as the other. So that's the kind of research we would like to do. But let's bring it back to the basics to actually figure out, why is this even happening in the first place? All right, so ammonium that is increased in blood circulation is very toxic. And we all know that toxic levels are very abnormal, and it can be fatal and lead to death. So if you look at our first liver here is our normal liver. So our liver is very healthy and red and juicy, and everything is functioning inside of it like it's supposed to. But what we want to focus on here is, what is the ammonium doing inside of it? So if you look at your first diagram that you have labeled Figure 1A in your handouts that you were given, you will see that the way ammonium actually enters the body is several different ways. One of the ways is exercise and seizures, which kind of go in hand because you're definitely working your muscles. So it's entering in there, and then it goes to the the liver. I apologize for that. Also, protein intake can also cause ammonium buildup. Bacteria overgrowth can also cause ammonium buildup. That's buildup in the gut. Okay? So what happens is ammonium comes into your body in one of those ways or the other, and your liver is responsible for converting that to urea, because ammonium is toxic. It needs to be converted immediately. So the liver job is, okay, take this ammonium, I'm converted to urea, and then I'm going to send that urea to the kidneys, and then the kidneys is going to excrete it out as urine. So that's the happy story of the normal liver. But for this presentation purposes, we're more focused on the cirrhosis of the liver, which is the damaged liver. So beside that normal liver picture, you will see an abnormal liver, which is right here. And for our purposes, it's the cirrhosis liver. So this liver is looking very sad right now. It doesn't look like it has a lot of circulation going on. It looks like it's struggling to even function. It actually kind of look overcooked, if you ask me. But let's see what's going on in the inside of that liver. So if you go back to that other figure, the figure beside of it is figure 1B, and you can actually see the ammonium metabolism in this one. So in this liver, the ammonium is so built up into the liver that it's actually sending it to the brain, sending it to the kidney, sending it to the muscles. So it's actually sitting in places that it shouldn't be going, because ammonia shouldn't be flowing all in your blood flow. But when it's in the blood, it's toxic and it's leading to the brain. And that's why critical levels of ammonium is able to seep into the brain and then cause confusion in the brain, and then leads to brain damage. So that's what we would like to try to prevent that from happening by going ahead and testing other subjects. That way, if a patient already has cirrhosis of the liver, because it does lead to the brain, we want to make sure that those ammonium levels, or actually see if those ammonium levels are building and building and building, that can lead to brain damage. But if we can see if they even have a correlation, that's the only way we're going to tell, okay, can we even prevent brain damage? Or if they have brain damage, can we even prevent cirrhosis of the liver? So that's why it's so important for us to be able to do the research on this. Because diagnosing liver issues early by testing for ammonium blood levels can help in preventing brain complications that can further lead to permanent brain damage. So we want to prolong people's lives here. So once again, we want to test patients with cirrhosis and brain damage because it can help determine what causes the body to keep producing that at a toxic level. So is it producing it at a toxic level because I do have cirrhosis of the liver, or is it producing it at a toxic level because of the brain? So those are our key points that we want to do, because we want to be able to prevent these people from keeping these toxic levels in their body, because early detection in these diseases can lead to longer life. And we can, when people get transplants, then obviously if the ammonium level is not a correlation with the cirrhosis, then their lives can be saved and they don't have to worry about getting brain damage. All right. So one of the things we can do is the collection of these specimens, which is just one EDTA tube, that's a lavender tube. One specimen can be able to test that ammonium level. So even though these patients are probably already getting all this other care and they're probably getting shots and all this other stuff going on, this one little tube, one little draw should not keep them in a hospital or anything like that. So I think that it'll be less invasive for the patient to be able to, not patient, the participant, to be able to want to do this study, because it doesn't cost for a lot of their time, it doesn't cost for a lot of their blood draw, it really just costs for their lab results. And I think in the long run, especially our expected conclusion is the patients that were diagnosed with brain damage all had increased ammonium levels in their blood, and it was the same in the liver, so that we can know, okay, they do have a correlation, and now we can prevent one of them from happening to the other. So if they do have cirrhosis of the liver, we can prevent them from having brain damage. So we would like for it to be a correlation, because if it's not, then we can't really put the two together to be able to find the reason why. So I know that's a lot for you to take in, but I really hope if you have any questions, you comment. And I thank you so much for being a part of this with me. And I hope you have a nice day. Thank you.